Hello, my name is Carlisle Holland, D.O. I'm a doctor of osteopathy. Many people don't know what osteopaths are. We have equivalent training medically to MDs, medical physicians, but we also have additional training somewhat similar to what chiropractors learn about, in that we appreciate the structure and function relationships of the body in ways that MDs do not appreciate them. But we essentially have equivalent medical training, and all 50 states have recognized them since 1973. We have a formal philosophy of medicine, however, which emphasizes the importance of appreciating structure and function in health. Essentially, we take an engineering approach to the body, and we integrate the systems of the body as we examine each system in the context of the whole. The purpose of this video is to explore the biophysics of tissue in a unique and interesting way that blends many disciplines from the biological sciences. This video attempts to make the basic physics and biochemistry that underlie these processes more understandable for physicians, physical therapists, and others who might use these concepts in patient care. I'd like to first cover a few key definitions and concepts that will help you understand the body in new ways. From the tiniest structures, the molecules themselves, and how they interact with forces around them, up to the mature adult creatures, these principles of mathematics, physics, physiology, and biology apply to all living things. Next, we'll go into the relationships between motion and non-motion in moving systems, and how these relationships set up axes of motion in the organism's tissues, especially as this applies to the cranium. Then we'll explore how the biomechanical forces interplay with these axes of motion and mold them visco-elastically and visco-plastically. But I'm getting ahead of myself, so let's learn the language first. First, configuration. Configuration is the arrangement of the parts of a system. Configurational relationship is the relative aspect of each of the components of the system as they relate to one another. Viscosity describes the property or quality of a gaseous or fluid body resulting from molecular attraction, which makes them offer resistance to flow macroscopically. It's the property of a solid of yielding steadily before constant stress. Visco-elastic deformation is when a viscous fluid is deformed, but all of the parts return to their original configurational relationships after removal of the force. Visco-plastic deformation describes when a force deforms a viscous fluid and the parts do not return to their original configurational relationships after removal of the force. A colloid is a term from physical chemistry that describes a gelatinous substance made of small, non-diffusible particles so that they remain suspended in a fluid medium. If the body is a colloidal fluid, what is structure? Structure is an abstraction. Now, what I mean by this is that the concept of structure is an abstraction when we apply it to living tissue. Anyone who studies anatomy and physiology in a traditional setting is biased by that study of dead, fixed matter. Some liken this to studying telephone poles to learn about trees. Body tissue is a dynamic process, a molecular flux with varying time for each molecule in the system. The human body turns over 98% of its molecules every 6 months. That's an incredible flux of molecules. And the remaining 2% turn over every 5 to 7 years. That scar we carry from a childhood injury demonstrates the persistence of a pattern of motion, not the molecules of the original healed wound. Hence, there's really no such thing as structure as we think of it when we talk about biology. It's an abstraction that helps us learn about the relationships of the tissue, and that's all. Next, let's look at how colloids and biomechanical forces interact. First of all living protoplasm is classified as a colloid, and all living tissue behaves colloidally. In order to learn about this, let's examine a simple colloid as found in cornstarch. This is a solution of cornstarch, which is a simple colloid. Simple colloids do not behave like you might expect, mechanically speaking. When you impinge on a colloid very slowly, it behaves like a fluid, just as you'd expect. So if you move the spatula up and down, it behaves like a liquid. But if you begin to impact upon a colloid very rapidly, it starts to act like a solid. You see the areas fracture here when I go faster and faster because the molecules can't flow as rapidly as the force is deforming the system. You can really see this when I hit it. When you impact on it, the spatula can't even penetrate it if you go fast, but if you go in very slowly, it's just like a liquid. This is why a karate chop works the way it does. What determines the ability of a karate expert to shatter a brick or a board is the velocity of the impact of his hand. The faster the interaction of the colloid with the target, the more solidly the colloid behaves. We see this in the hospital when we administer blood. When blood is infused slowly, flow ceases. And when it's infused very rapidly, it also stops flowing. This is an example of nonlinear colloidal behavior of blood. Now, when we start to talk about colloids, we need to also get another couple of terms here, and one is that of a Newtonian fluid. A Newtonian fluid is a viscous fluid that shows resistance to flow that is linearly proportional to the rate of flow. This means that for every increase in pressure, you get a proportional increase in the flow from the Newtonian fluid. A non-Newtonian fluid is a viscous fluid that shows resistance to flow that is non-linearly proportional to the rate of flow. In other words, the change in the rate of flow is not linearly proportional. Most pathological changes that we see in colloidal mechanics involves a non-specific type of thickening of the tissue or a loss of fluidity and a shift toward solidity of the tissue. Colloidal nonlinear mechanics explain why gentle forces in craniosacral techniques have effects out of proportion to the force. I liken it to whispering to your spouse instead of shouting at them to get your way. By not evoking guarding mechanisms, the colloid can behave like a fluid, nonlinearly in relation to the forces. Another important concept here is that the restriction of motion can involve any gradient of pressure or any volume of tissue. From focal restrictions involving joints in which there is a small volume of tissue with a large motion restriction and a large pressure gradient, to chronic postural adaptation mechanisms where there's a large volume of tissue with a very small pressure gradient spread out across the restriction. There's an entire spectrum of colloidal motion restriction. You can't talk about fluids very long without having to talk about turbulence. And I'd like to next go into what is presently understood in physics about turbulence. This first picture is a jet airplane in a wind tunnel. And if you look at this picture very carefully, you can see the symmetrical swirls of smoke as they course around the shape of this aircraft. Notice how they spiral around in symmetrical patterns from one side to the other, and yet each side is perfectly balanced and symmetrical. This reflects turbulence in the flow of the fluid past the aircraft. Now, our understanding of turbulence is undergoing a rapid change at this point in history. In the 30s, when a man named Reynolds first described flow with mathematics, he was able to describe laminar flow or linear flow. But it's only been over the last 5 to 10 years that we've had supercomputers that allow us to do the complex mathematics involved in understanding what it was heretofore called chaotic flow. What we've learned is that there is no such thing as chaotic flow. Instead, what we see as highly differentiated order is present in the flow. Now, to understand turbulence, let's look at this sequence of pictures in which we first describe what's known as laminar flow in a tube. You'll notice at first that the central part of the tube is flowing smoothly. But as the flow accelerates through the tube, a layer is created between the fluid and the non-moving tube wall that begins to undergo a change from the standpoint of how the forces are dispersed through them. And eventually what is set up is a non-linear transition zone at the wall of the tube. As this progresses, you begin to develop cells of turbulence that swirl around and interfere with the normal flow through the central portion of the tube. And eventually this flow becomes so chaotic that it actually can interfere with efficient flow through the tube. When you look at a diagram of how the surface begins to peel off into cells, as shown in this computer model, you will see that the transition from laminar to nonlinear flow is an interesting structural configuration in the context of biology. Because when I first saw this picture, which was made at the Center for Nonlinear Studies in Los Alamos, New Mexico, of a fluid going from a laminar to a nonlinear flow pattern, I said, I have seen this picture someplace before. And then I was looking through my histology text, and I ran across this picture, which represents a histologic slide of the surface of a lymph node. And I couldn't help but be taken by the similarities between this histologic slide and the diagram of a transition between laminar and nonlinear flow as shown in this computer diagram. These transition points from laminar to non-laminar flow may be the basis for tissue planes and could represent transitions in the flow of the gel of the colloid where there are abrupt nonlinear so-called catastrophic transitions of flow. Now, to understand catastrophe, it's helpful to look at this simple diagram of catastrophic waves. As a wave begins to organize itself and peak, it reaches a point at which the momentum of the wave makes it to where it begins to crest and roll. And as it begins to crest and fall, the wave has to go through a reorganization. And this point at which it can no longer support the waveform is termed a catastrophic event, or a bifurcation. At that point, the wave has to reorganize itself, and the energy system of that wave has to assume a new configuration in order to balance the forces within it. It was this idea that set the stage for the development of another concept in mathematics called fractals. And in mathematics, fractals are proliferating into all the areas of the sciences because they have given us a way to express nonlinearity mathematically. Nonlinear mathematical relationships were the mathematics of chaos, of turbulence, of swirls and eddies that we could not describe before. Fractals describe dimensionality, and they also describe algorithms or mathematical patterns. Fractals demonstrate relations between patterns of energy and the physical form in different dimensionalities of that energy. At each size, the algorithm is expressed, although in a different way, because the interplay of forces is different at each dimensionality of the tissue. The concept of dimensionality comes from the question, how long is the coastline of England? And the answer is that depends on your perspective on the question. From outer space, it might look like it's just a few thousand miles around it. But if you got much closer and you saw the detail of every little nook and cranny of the water as it comes in and out on the shoreline, you'd find that the distance around England could become infinite. So it was this appreciation of the idea of dimensionality that set the stage for the development of fractals. Now, to understand what a fractal is, let's look at this simple diagram that illustrates a mathematical pattern, a triangle, and how when you change the dimensionality of that pattern, how it begins to alter the properties of the macro structure or the aggregate of all of these algorithms. Now, first you'll see that at the top you have a triangle, and then you change the dimensionality of that triangle. You make it smaller, and you apply that pattern to the first pattern. And then you do the same thing again. You reduce the dimension further and apply that pattern to the other pattern. Now, this illustrates a bifurcation point. Every time that pattern no longer will sustain that energy form, it has to shift to another dimensionality, and it comes out at that other dimensionality in another way. At the point at which it shifts, that's known as a bifurcation point. And at each of the different sizes is known as a dimensionality. Now let's look at this video of some real leaves. Now note that the patterns of the angles within the leaves themselves are essentially the same angles as between the twigs on the limbs. And also notice how the angle between the twig and the limb is essentially the same angle, and the angle between the limbs and the angles between the limbs and the trunk. These illustrate how in biology, again, you see the same algorithms, the same patterns at work, but at varying dimensionalities. And what determines it turning into a leaf at one dimensionality and the trunk of a tree at another is the property of the algorithm at that dimensionality, at that interplay of forces. This is a fractal leaf as generated by a computer. But you can see how the algorithms, how the patterns generated here by a computer illustrate the same principles as the living leaves. This is a picture of a fractal vascular pattern. Now, one of the most exciting aspects of fractals in the context of biology is how fractals can explain the interrelationships between energy needs at the tissue level. In this diagram, we're looking at a pattern that looks very much like tissue. You see, in a Euclidean model of geometry, the idea that you can have an artery and a vein near every point in a system, and that it can take up a negligible space in that system so you have room left over for parenchymal tissue, seems paradoxical. But in a fractal sense, you can have an artery, a vein, a bronchus, all of these factors interplaying and proliferating down to all the dimensionalities. And this allows us to describe biological forms in ways that were heretofore impossible. Fractals demonstrate relationships between patterns of energy and the biological form, the physical form, at these different dimensionalities. Now let's examine how fluid systems resist gravity. This is a diagram of a vibrating liquid. Now you see these things in the shower. If you look down at the floor when the shower is spraying in the mornings, you'll see these little drops dancing along on the tile. What you see here is a diagram, actually a picture of one of those little vibrating liquid forms. When one considers what happens when a fluid system, like a biological organism, is able to lift itself up from the gravitational well that is the Earth and move about in the gravitational field, one has to be puzzled that a liquid system can do such a thing. If you look at how a fluid is percussed, though, and vibrates against gravity, you'll see that as the central percussion comes in and displaces the water and it wells upward and shoots upward, a central column of force is created in which there's a higher pressure gradient in the center of that fluid system. And then as it comes up to the top and sprays out in all dimensions, it begins to be influenced by gravity and fall downward on the sides. Now this basic arrangement of having a central core of high pressure welling upward, spraying outward, and then falling laterally or to the sides describes the way that vertebrate organisms resist gravitational fields. Now this, of course, is the opposite of how invertebrates do it. They do it with a high pressure zone on the outside and a central pressure zone that falls. But basically the idea is that a fluid system has to have an upwelling and a downfalling component. First, we need to cover the concept of a modulus. The simplest modulus to understand is the modulus of elasticity. Now, this describes a coefficient that describes the change in dimensions per unit change pressure in a system. The concept of the modulus of elasticity is best illustrated by a rubber band. If you deform a rubber band with too little force, it doesn't deform at all. And then as you increase the force on the rubber band, there's a zone of tensions over which the rubber band can most successfully interact. And if you exceed that range of tension, you can break the rubber band, and that's known as the modulus of rupture. So there is a critical range of tensions over which any system can operate. And the range of energies that it operates over are a function of the components, the physical component of that system. A dynamic modulus is a complex modulus of multiple variables interacting. In a biological system, you can't enumerate each and every variable, but you can certainly collectively describe them with the concept of dynamic modulus. Two researchers, McMahon and Kleiber, took this concept a little further. They described what's known as the mouse-elephant curve. Now, when one looks at a mouse, you notice how rapidly they move, how rapidly they breathe, and how rapid their metabolism is. This is a way of describing a flux of energy through their systems. They have very rapid fluxes. And in nature, the tendency is for very small creatures to have a very high metabolic rate and to have a very rapid flux of energy through their systems and a very short lifespan. Now, at the other extreme of size, in elephants and large creatures, one tends to see a very slow metabolic rate and a very slow flux of energy through the system, and a longer lifespan. Now, the mouse-elephant curve, as these researchers described, has two components. First, if one looks at the metabolism, we see this as a relationship of energy, such that the more rapid the metabolism, shown here on the left at the top above the mouse, the smaller the creature. And the slower the metabolism, is shown on the right side here under the elephant, the larger the creature. Now, there is an inverse to this that has to do with the opposite of metabolic flux, which is the stability of molecular relationships, or the solid end of it. And that is that the more easily that a solid is broken or shears, the likelier that the creature is to be small. And if the property of the tissue is such that it has a good resistance to shear, so that it's, quote, stronger, end quote, the tendency is for the organism to be larger. And using a mathematical equation based on turbulence that describes these relationships, McMahon and Kleiber were able to make predictions based on the tissue, the molecular properties of the tissues, the engineering properties of the tissue, that would predict the ultimate size and proportions of the organisms that were studied. This describes the ability of the molecules to capture a specific spectrum of energy, to interact with a specific spectrum of energy. Now remember that both describe the flow of energy and the interaction of the molecules of the system over time. The macroscopic is interdependent with the molecular interactions across these dimensionalities between them. Each species, then, is seen to occupy a unique energy niche, a spectrum of energy and time interaction that is unique to that individual organism. Another concept from engineering that has relevance here comes from the semiconductor industry, and that is of excitonic matter. Now, the semiconductor industry is based heavily on silicon crystals, and silicon crystals are piezoelectric. That is, that they have special properties regarding their conductivity of electricity and their interaction with physical forces. Now, in this diagram, you'll see a piezoelectric crystal matrix with the electrons flowing through it. When this crystalline matrix is deformed by a physical force, as shown here, there's a zone set up within the crystal in which there is an altered availability of electrons locally. In production of chips, if a clamp is pressing on one area of the crystal and there's an increased availability of electrons, metal ions that are sprayed onto the chip to alter its electrical properties will have increased deposition in the areas where the clamps are placed. This can interfere with proper electronic processing through the chip. Hence, the conductor industry had to figure out a way to describe this. Now, there are no alterations in the molecules, there's no change in the atoms, and the electrons are essentially the same as electrons in other areas of the crystal. But what has changed is that within the area where the physical deformation is altering the crystal, there's an increased probability of the electrons being available. Now, the idea of a probability gradient being affected by physical forces is relatively new to physics. So they had to come up with a term that didn't include chemical changes or atomic changes, and what they came up with was the term excitonic matter, increased availability, a probability gradient within that crystal. Now, it's very likely that there is something analogous to this going on in biology. I have coined a term called bioexcitonic matter to describe this type of process in biological systems. When a biological tissue interacts intermolecularly with a macroscopic force, there are no changes in the molecules, there are no changes in the atoms directly. But what happens is that there's an altered probability gradient locally in that tissue that is a reflection of the physical force as it transfers through it. If you read the literature that concerns using electricity to enhance bone healing, you'll find that in studying the mechanical properties of that bone in regards to conduction of electricity, they found that in the areas of the bone where the forces transfer through, there are what are known as streaming potentials found. Now, these streaming potentials reflect increased availability of electrons locally in the hydroxyapatite crystal of that bone. Could this be the basis for Wolff's Law? For those not familiar with Wolff's Law, I'd like to read from Stedman's Medical Dictionary. And it says that every change in the form and function of a bone, or in its function alone, is followed by certain definite changes in its internal architecture and secondary alterations in its external conformation. By the way, this is a mathematical equation that describes turbulence. Could it be that Wolff's Law is describing bioexcitonic matter? Consider interspinous ligaments. Did you know that interspinous ligaments are acellular? Certainly there are fibroblasts that migrate through the interspinous ligaments, but interspinous ligaments are primarily collagenous structures. When one looks at collagen fibers under the microscope, you can see this alignment of the molecules in the tissue. When one looks at logs floating down a stream, you'll note that the logs line up with the current, not because the logs know what to do, but because thermodynamically it's the most stable relationship between a long structure and a flowing fluid. If you look at the collagen fibers, you'll note that they align themselves all by themselves with the directions of forces that persist through that tissue. A similar process can be seen in muscle, as shown here. Note how the actin and myosin fibers all line up together and how the actin-myosin complexes describe a highly organized relationship between forces at the macroscopic level and the molecules down at the microscopic level. In certain tissues, the forces vary between positive and negative pressure gradients, and this would be where you would find muscle, because muscle can vary its configurational relationships. When actin and myosin contract, they spew off water, so they dehydrate and go from a fluid state to a solid state. And when muscles lengthen, they increase the hydration of the actin-myosin complexes so the volume of the muscle can increase. So muscle can be viewed as a special type of tissue, a specialized type of tissue that can vary its configuration. And the development of muscle, from the standpoint of evolution, coincides with the development of the nervous system itself. And indeed, the analogy that Dr. Kim Kaur has used, that the neuromusculoskeletal system could be viewed as the primary machinery of life, certainly has relevance in this context. Now, persistent negative gradients would be what you would find in tendons and ligaments and membranes. So if there was a constant negative pressure gradient across the tissue, the body will deal with that force by generating collagen and elastin so that it doesn't have to waste energy contracting muscle against the persistent force. And indeed, when you see a muscle that has been subjected to a constant negative force, it tends to fibrose and form tendon-like fibrotic adhesions within the muscle. So you see the pattern in the muscle reflecting the forces coursing through the structure. When a positive pressure gradient comes in along a pathway that is designed to deal with, that the tissue can handle metabolically, it tends to form cartilage and bone. Bone is when the tissue actually forms a crystal around the cells instead of a gel that's found in cartilage. But if a force comes in compressively from an angle that it's not designed to deal with, you get a nonspecific thickening of the tissue, as seen in a condition called myositis ossificans, where you get calcifications in muscles that are hit from angles in which they're not designed to deal with the force. You can see these force pathways in the normal morphology of bone, in the trabecular patterns of the bone. Now, all these interplays of forces have to do with concepts from mathematics known as topology, and we're talking about the topology of tissue. The way that tissues enfold describes a relationship between motion and non-motion in the tissue. Now, one considers the idea of motion versus non-motion. Sometimes it's helpful to look at simple diagrams and to understand more complex relationships. Now, if you look at this picture, you can see 7 points on either side of this diagram, and we're going to examine the interrelationships between these points in this relatively simple system. So we're going to connect each of these points with each of the other points. And as you do this, you note that there are areas that seem to have a lot of red lines present, and there are areas in the center part here that have no red lines present. These central areas would be areas of relative non-motion, and the areas where the red lines connect could be viewed as areas of increased probability of motion. If you look at this picture, the areas of non-motion are shown as gray, and you can fill in the areas of the most motion in pink. Now, when I looked at this diagram, I said, I have seen this someplace before. And I realized that the central parts look very much like the spine, or the areas in the body structure that move the least, from a molecular perspective. And the areas that were pink look like the way that the muscles are laid out, which again reflects a motion relationship within a moving system. If one looks at a drum head and you put particles of sand on top of the drum and then hit it with the drumstick, you'll note that harmonic relationships are set up on the surface of that drum, where there are aggregates of particles in the zones of the drum head that move the least. This illustrates the same principle as the diagram shown here, that being that the potential areas of movement have the greatest likelihood of movement and the least likelihood of stable molecular relationships, and the areas of least motion are where the particles tend to aggregate with the greatest probability of increased interparticular, or in a biological system, intermolecular relationships. The areas that move the least have the longest term molecular relationships, just as we see in bone and cartilage. Now, the idea that vibrational patterns could interact with biological systems and set up patterns of motion is not new. The ancient Chinese described something very similar to this in the golden ratio. The golden ratio describes harmonic relationships in systems. Could these harmonious relationships that we've just described have something to do with how relatively simple life forms, like those that create seashells, can develop such intricate and beautiful structures? Is this a reflection of the harmonies within the non-moving portions of these organisms? If you look at this simple plankton, you can see the same principles at work in this vibrating little creature. There are areas that move the most in which the creature is clear because the molecules are moving all the time. And in the areas within the creature where there is the longest term vibrational relationship, the longest term molecular relationships, you see what we call structures present. In invertebrates, you see that the areas of increased molecular interaction, where there's a longer term molecular interaction, are seen on the outside. So they have what are known as exoskeletons, or hard parts on the outside. And the central parts of their bodies vary their configuration and have the shortest term molecular relationships. In vertebrates, as shown in this dinosaur, just the reverse is true. The central portions of the colloid have the longest term temporal relationships, and the areas on the outside, the skin and the muscles and so on, have the shortest term intermolecular relationships. Now, these harmonic relationships also fractally propagate out into the parts. If you look at this diagram, you see the same harmonic relationships at work in the hand. So each of the parts of the body also harmonically expresses the same algorithm, but at different fractal dimensionalities. And how that fractal manifests in that individual area is a function of the pattern and the form. Now, when you look at the human being, you see different types of harmonic relationships, different relationships between motion and non-motion from those that you may have thought about previously. When motion is introduced now, not in just the coronal plane, but in the sagittal and horizontal plane, new interactions of motion emerge. First, let's turn the motion diagram on end and see what happens when we make it oscillate on the horizontal plane. Next, if a third axis of motion is introduced in the sagittal plane, even more motion relationships emerge. Note the little areas of black on the sides of the diagram here with all three dimensions of motion. Could this be how limb buds form? As long as the limb bud is wider than it is deep, there's essentially no differentiation of the cells within the limb bud. As the limb bud grows longer and the vibrational patterns that go into it grow more complex and resonate within that limb bud, the tissue patterns begin to emerge in what we recognize as the patterns that will set the stage for the mature limb. As the limb bud grows longer and longer, the arm and forearm in the forelimbs will fractally express these patterns of reverberation until, finally, the digits and details of the fully differentiated limb emerge as these patterns grow more and more complex. Like the hub of a wheel moves least in that motion system, the non-moving portions of the colloid create an axis for motion. Also, like the hub as the reference point for that moving system, the position of the whole bony axis becomes the point of reference for the vertebrate system. A few years ago, I found this fish skull while walking on the beach in Corpus Christi, Texas. Now, this is a close-up of that fish skull, and you'll note that there's a central strut down the skull and that there are secondary patterns off on either side that are symmetrical patterns. If one looks at different types of vertebrates moving, shown here on the left you'll see fish and how they oscillate as they move along in a fluid, and on the right you'll see how quadrupeds, amphibians in this instance, walk. If one looks at this walking vertebrate pattern, you'll note that along the vertebral axis are the long wave patterns of the body. And then if you note the patterns that come in through the limbs and are mediated along the facets in the spine, you'll note that these are harmonic relationships that describe shorter wave forms than the long waves along the vertebral axis. If one looks more closely at this vibrational pattern, you can see how the pattern carries on over into the brain case. Shown here is the hyomandibular arch off to the side, as well as the central strut of forces coming in along the vertebral bodies. These patterns of interaction are seen in all vertebrate skulls. Shown here are 4 different types of fish skulls, but you'll note that all of them have a central strut and a first harmonic pattern off to the side that coincides with the hyomandibular arch. If you refer back to the picture of the jet turbulence that we looked at originally, you can see how these harmonic relationships between the forces are expressed in the structures of the skull. Another concept from engineering that has relevance here is that of torque. And if you study torque, you have to talk about the right-hand rule. Now, the right-hand rule means that if you are observing a rotating body, that if the body is rotating counterclockwise, if you look down toward the surface of the earth and watch it spin, there's going to be a force generated along the axis of rotation perpendicular to the plane of rotation. And it will follow what's known as the right-hand rule. That force would pass along the direction of the thumb if the direction of rotation went in the direction that the fingers point on the right hand. If you look at this picture of a pencil, you can see that the thumb points upward with the point of the pencil, and that the rotating object would be going around counterclockwise in the same direction as the fingers are pointing. If you look at this diagram of the vertebral column oscillating as it walks on the earth, this diagram illustrates left torque. As the vertebral column rotates to the left, that means that torque would be generated in a way away from the earth, away from the direction in which gravity would tend to want to pull the organism downward. So left torsion, or left torque, tends to generate anti-gravity forces. If one looks at right torsion, you'll note that right torque will tend to do the opposite thing. As the body rotates to the right, the tendency is for the torque to generate a force that is downwards. You can see this same process at work in living trees. If you look at these trees, you can see how the tendency of the tissue of the tree is to spiral upward in a left torsion pattern. This means that the common compensatory pattern that we see as clinicians, in which we see left torsion of the sacrum, right piriformis dysfunctions, right lower lumbar dysfunctions, and so on, reflects the tendency of the tissue to left torsion. This also sets up what is known as the common compensatory pattern. Most people have some leg length difference. About 80% of people have greater than an 1/8 inch sacral base unleveling to one side or the other. But 80% of that 80% have left short legs. So when one considers how torsion and torque influence the body's growth and development, you see that the right and left lines of positive pressure that come up from the feet, up through the pelvis, up into the body structure, are asymmetrical because of the effects of torque. If you look at those patterns of motion, there tend to be nodes at the sacrum, at the thoracolumbar junction, at the cervicothoracic junction, and at the base of the skull that reflect where these oscillating patterns crisscross. But because they tend to be asymmetrical, these patterns of forces are hardly ever perfectly symmetrical in a normal human being. Between these nodes of non-motion, there are areas of lateral oscillation, and in these oscillation zones, there are differing behaviors of the muscles that control the oscillation. From the midpoint of the oscillation downward, you tend to have overload of the extensor muscles, the ones that control the forward lurch of that spiraling vertebral column. From the midpoint of the oscillation zone upward, you tend to have dysfunction of the flexors, the muscles that control the acceleration of the upper part of the spiral toward the next node. These ideas of rotation and spiraling and force transference have further implications from the standpoint of engineering and body structure. Consider the concept of polar moment of inertia. Polar moment of inertia is best illustrated by a skater. If one watches a skater begin to spin, as they first spin, they have their arms and legs extended. And then as they pull their arms and legs inward, one notices that the skater spins faster and faster. This is an illustration of the polar moment of inertia. You see, when a person has a high polar moment of inertia, it means that their mass is distributed more broadly. A car that has a motor in the front and a heavy transmission has more difficulty turning than a car that has the transmission right in the center. When the mass of the body is concentrated toward the center axis of motion, it's said to have a lower polar moment of inertia. And when that mass is spread out more laterally from the axis of motion, it's said to have a higher polar moment of inertia. Now, we've covered many terms up to here, and I'd like to go over some key terms before we go into the clinical aspects of these ideas. First of all, configuration. Configurational relationships describe how the parts of a system are put together and how they relate to one another. Viscosity describes fluid motions and how the molecular activities within a system can influence its macroscopic flow. Deformation describes how forces deform a physical system. And Visco-Elastic describes deformations that go back to their original configurational relationships. And Visco-Plastic deformations describe deformations that do not return to their original configurational relationships. Colloids is a term from physical chemistry describing all protoplasm as a nonlinear medium. And if you talk about nonlinearity, you have to talk about Newtonian versus non-Newtonian fluids and how linearity affects systems. Turbulence is a concept of flow in which flow becomes nonlinear. Fractals is the mathematical concept that allows us to begin to understand nonlinearity and bifurcation in so-called catastrophe or chaotic mathematics. A modulus describes the range of energies over which a system most successfully interacts. The critical range describes the spectrum of energies that the system is best designed to capture. Bioexcitonic matter describes an interrelationship between macroscopic forces and molecular forces, describing altered probability gradients locally. Topological enfoldment describes how areas of motion and non-motion interact in the macroscopic system. Torque is a term from engineering describing rotation and how forces can be generated in directions that don't seem relevant to the direction of rotation and follow what's called a right-hand rule, as we covered earlier. And polar moment of inertia describes inertia and how it affects rotating bodies. Traditionally, the components of the primary respiratory mechanism, the cranial mechanism, have included 1, the inherent motility of the brain and spinal cord, 2, the fluctuation in the cerebrospinal fluid, 3, the mobility of the intracranial and intraspinous membranes, the articular mobility of the cranial bones, and 5, the involuntary mobility of the sacrum between the ilia. If one thinks about inherent motility of the nervous system in the context of biophysics, the pulsations of the nervous system and ultimately the neuromusculoskeletal system are seen as a quantum expression of all the multitude of variables expressed in the physiologic processes of the nervous system across time. This would represent literally the interface between mind and matter. When one considers the fluctuant properties of the CSF, the liquidity of the tissue as one extreme of the continuum of phase relations from liquid to solid becomes relevant from the standpoint of biophysics. The fluctuations would express fluid forces as waves within the living colloid. The membranes, ligaments, tendons, and so on would describe expressions of linear negative pressure gradient pathway. These are how forces mediating acceleration reflect these tension pathways in the colloid. Articular mobility of the bones and cartilage of the skull and the rest of the body would express long-term intermolecular relationships, areas of non-motion, and their interactions with the macroscopic motion patterns of the moving parts. The involuntary mobility of the sacrum between the ilia and indeed the entire spine makes one appreciate the topology of the nervous system both embryologically and functionally in the mature organism and the subsequent configuration of relations. We begin to see these disturbances of normal motions as components of dysfunctions in the system. If one watches the craniorhythmic impulse from the side, you'll notice that during expansile phase, or so-called flexion phase, that the frontal bones go forward, that the sphenoid bone also flexes at the sphenobasilar symphysis and dips downward, that the occipits go inferiorly and posteriorly, and that they control the positions of the temporal bones, which flare laterally and carry the parietal bones above them with them. Hence, during the expansile phase, the volume of the skull seems to increase, and the top of the skull comes down slightly as the lateral parts of the skull expand. If one looks at the front of the skull, you can see that normally you would see symmetrical motion, as shown in this fetal skull X-ray. If one looks at the base of the skull in normal symmetrical motion, all of the parts excurse equally about sagittal plane. When one looks at asymmetry of motion, as shown in these diagrams, when there's a displacement of forces to one side, as shown here to the right, you get what's known as a right side bending rotation pattern, and there's more movement on the right side than the left side. And the mandible is displaced toward that externally rotated temporal bone because the TMJ fossa recedes and it tends to shift the mandible to the side that the skull is leaning. When one looks up at the base of the skull and considers what happens in torsion motions, you'll notice that the diagonal components of the quadrants of the skull, the right front and the left posterior, or the left front and the right posterior, move externally together, and the reciprocal diagonals, the opposite ones, tend to move less when you have a torsion pattern. In side bending rotation patterns, as shown here in this right side bending rotation, the whole right side of the skull moves laterally, and the left side does not move as well, as it's restricted in its excursion laterally. Hence, you can't separate one part of the body from the other, and the osteopathic concept of treating the whole person takes on a physical as well as a conceptual relevance. Now, one more concept we have to hit in relation to the cranial mechanism is that of a vector of injury. Now, if you look at how a vector of force comes into the cranium, we know from pathology about the cone of force seen in gunshot wounds. But that's just one extreme of a continuum of forces, all the way from very mild forces to very extreme forces, and how those forces transfer through that colloid and affect the intermolecular relationships. There's a continuum of force from severe injury to mild injury. And indeed, most of the research on head trauma now indicates that some of the chronic conditions of dysfunction of the central nervous system, as seen in presenile dementias like Alzheimer's disease, are linked very closely to a history of head trauma. Perhaps the cranial mechanism will someday help us understand these processes in a new light. One of the reasons I like to talk about cranial deformation in newborns is that nobody argues about whether or not the skull of a newborn is deformable. It's necessary for the birth process. The transit of the bony pelvis presents a considerable risk for deformation of the craniosacral system. Patterns set into the system at this point can last a lifetime. In this sequence, we see the baby's skull as it comes through the birth canal in a brow presentation. When one considers that the skull at this point in the baby's life has the consistency of a milk carton, is it any wonder that this carries such risk for the baby? Many people ask me why more research is not done in these areas. And the answer is the technologies to measure what we are doing when we use these concepts in medicine are only becoming available at this point in time. One of the best illustrations I can show you is that of MRI, and in a case involving a little girl who comes to see me from Mexico. Now this little girl, when I first met her, was around 1.5 to 2 years of age. And as you see here, she's a cute little girl. Now this is an MRI of this child when she was 3 months old. And this is a sagittal view, and you can see the immature development of the facial bones and the brain above. Now if you take a horizontal section through her skull at the cranial base, you'll note that this child has significant cranial dysfunction. If you look at the occiput shown here at the bottom, you'll see that there's an actual fold in the occipital membranous bone. But if you look at the cranial base, you'll note that the structures of the cranial base, the eyes and the crisscross struts across the cranial base, as described in the earlier diagrams, are roughly symmetrical. Now, this child had an in utero trauma. She was a second-born twin, and her brother apparently pushed up against her while she was being carried in her mother's womb. Now, the child had significant developmental delays, did not walk and could not do certain motor skills as quickly as her brother, so they did this neurological workup on her to find out what was causing this. And by the time the child was 18 months of age, another MRI was performed to investigate how her nervous system was developing. If you look at this picture, you can see now how a pattern called a right lateral strain, in which the facial bones are shoved to the right side. Now the right side would be the top left. You're looking up into the skull in this picture. Notice how the palate is distorted and the teeth now are being bent in a pattern in which the face is shoved to the patient's right. If you look at this diagram, you can see how the left parietal bone, which has been carried over to that right side, is pressing against the cortex of the brain and has actually caused thinning of the cortex and increased prominence of the fissures on the left side of the cerebral hemispheres. If one looks at the cranial base and compares it to the earlier MRI, you'll note that now the occiput is relatively normal looking. The huge wrinkle that we saw in the occiput is now gone. But if you look at the sphenobasilar symphysis, the horizontal section that we looked at earlier, you can see that there have been tremendous changes. What has happened here is that that distortion of skull mechanics has set up what we call an intraosseous strain, an alteration of force transference through the bone itself. Note how the eyes now are asymmetrical and how the strut features that we saw in the earlier diagrams are now also becoming asymmetrical. Now this describes what we call a right lateral strain of the sphenobasilar symphysis. And this picture is one of the most exciting I have ever seen in the context of craniosacral osteopathy. If you zoom up on the sphenobasilar symphysis, as shown in this diagram, you can see an actual displacement of the sphenoid body to the patient's right in relation to the basi-occiput. This is the first time I have ever seen clinically demonstrated on MRI a craniosacral dysfunction. Now the MDs who read these MRIs did not place any significance on this, but it is significant from the osteopathic perspective, and certainly from the standpoint of strategies to try to help this child, it can make a big difference in her life. And if you'll look at this picture of Mariana when I first saw her, you'll note that there is tremendous asymmetry of her face. Her mandible is displaced to the right and makes her right cheek seem fuller. Her left eye seems pulled in and the left orbit seems smaller than the right. The right side of her face is much wider than the left, and the right ear is turned outward and the left ear seems closer to her head. Now, if you look at this picture, after 2 weeks of daily treatment at the Osteopathic Children's Center here in Moon Valley, you'll note that there's been a tremendous improvement in the symmetry of her face. The eyes are more equal, the forehead is more equal, the chin is more in midline, and the ears appear to be better balanced than in the previous picture. Several scientists suspect that a tendency towards suicide, as well as a predisposition to drug addiction, may be linked to traumatic birth experiences. They say that a traumatic birth may place some children at risk for later self-destructive behaviors, although they don't yet know what percentage of children are affected or what the cofactors may be. Craniosacral manipulation is an area of medicine that is poorly understood by most physicians in the 1990s. For almost 100 years, osteopathic physicians have utilized cranial manipulation to influence the health of patients in a variety of clinical situations. From newborns to the elderly, these gentle and effective techniques offer methods for enhancement of the function of the body that other methods of manipulation do not offer. This video attempts to make the basic physics and biochemistry that underlie these processes and these methods more understandable. It certainly gives us something to think about.